John Bird and John Fortune, as part of Bremner, Bird and Fortune, had put together a sketch just as the internal market within the NHS was being established, and they rather beautifully skewered what that was going to mean. Now we've had, 10 years almost of the internal market within the NHS, and almost everything they predicted is more or less what has happened.
So we didn't have to change anything about the sketch, did we?
No.
And it's, 16 years
We
old?
changed the tense. George Parr.
Hello.
You have recently been appointed Chief Executive of the Herefordshire NHS Healthcare Trust.
That's right, yes.
With a remit to continue bringing the discipline of the market to the National Health Service.
Very much so, yes.
In charge of 11 hospitals.
No, well, 2. 2, it was 11, but we've downsized a little bit.
I see.
In the interest of efficiency and, just slimming it down a bit, really.
Right. Well, I mean, that's what we're going to talk about, isn't it? The discipline of the market. Yeah. Was this the first thing that you did after you've been appointed?
The first thing that we did, which is something that our colleagues in the private sector have done, is to take ourselves off to a country hotel for a weekend, for the whole week, actually, and brainstorm our problems, and we came up with some pretty tough decisions, I can tell you.
To downsize being one of them?
Yes, downsizing was one of them. Also, one of our first things was to give ourselves a large increase in salary and then make a corporate video.
Well, as Mrs. Thatcher once noted, the problem with the NHS is that demand is infinite.
Oh, yes, I mean, the facts are there. The demand on the NHS has never been greater. Yet, at the same time, the health of the nation has never been better. Now, this can really only indicate one thing.
What's that?
That people, or patients, are not really ill.
People are presenting themselves to hospital without illness?
Oh, yes. I mean, I think it's very much like the benefit system. I mean, people know that they can get unemployment benefit. They are being rewarded for not working. There is no incentive for them to go back into work.
I understand.
And in the same way, people feel that they can be rewarded for being ill by being treated. And there is no incentive for them to get better. So what we're looking to do is to push incentive because we think that's a really good market.
Right, so you're going to continue to bring the discipline of the market into the NHS, indeed even expand upon it?
Yes, we're going to expand upon it. We're going to expand upon it in how hospitals are actually run. We want to expand on the efficiency and on the savings that the marketplace can bring.
In what sort of way?
Well, I'll give you an example. In the old days, the surgeon would walk into an operating theatre, and there'd be a body, and he'd want to cut it open. And he would ask for a scalpel. And the nurse would give him a scalpel with no consideration about whether he needed the scalpel, whether the scalpel was necessary, or whether indeed he could get the scalpel cheaper somewhere else. Or indeed if he could use a razor blade from home, or a paper clip, or indeed his own teeth if necessary.
So what happens now?
Well, what happens now is the surgeon, if he deems that a scalpel is necessary, he will put out a tender. He will put out, he'll put out a bid for a scalpel. A tender for a scalpel. And the first thing he'll do is he will ask around the operating theatre to see if another nurse has a scalpel cheaper than the nurse next to him, which will be quite difficult as we only have one nurse in the operating theatre. And now this is an appointment I've put in myself, the scalpel resource manager will then, and he's been put in on a salary of £45,000 a year. Now as soon as he knows that a scalpel is needed...
Well, perhaps
needed. In operating theatre A or B, well, it will be A, we only have one operating theatre. As soon as he knows that a scalpel is needed, he bursts into action. He phones round the whole country, sends faxes, to see where he can find the cheapest scalpel. Now, if that happens to be in Barrow-in-Furness, then that's where he will go.
He will personally go and get it?
Yes, he will go himself. Absolutely. He's not going to send it in the post.
Of course not. He'll jump in the car.
Yes, he'll get in his Series 7 BMW, which is what he gets for the job.
Otherwise, he wouldn't be taken seriously.
No, quite right.
But some might say, with all this radical reform, that it may be possible to get rid of the middlemen entirely.
What do you mean, get rid of the doctors and the surgeons? Yes, well, that is something we've been thinking. What it's about is patient choice.
Yes.
Isn't it? I mean, You want to empower the patients to make their own decisions.
Yes.
And make their own incisions.
Sorry, how would that...
I'll tell you. So patient walks into doctor's surgery with a growth. And says, I've got a growth. What are you going to do about it? And I will say, what are you going to do about it?
And then you would empower them to use yours?
Well, we'd lease an operating theatre.
A mirror?
A mirror, and a book on major surgery and how to do it.
And then they would resource that themselves?
Yes, they would be able to be resourceful. They would be able to resource themselves. They would be able to stand on their own 2 feet. Well, perhaps not if they've had an anaesthetic for...
Down there.
Yes, yeah.
But in terms of pure management, don't the patients then rather just get in the way?
Well, yeah. I wouldn't say they get in the way so much. But, you know, what we're trying to do is have a thrusting business atmosphere, but of course, you know, the managers are going to have to find some way of assessing performance. You know, this has to be very simple and it has to be easily measurable.
Well, how carefully a doctor looks after his patient?
No. It's what we call in the business throughput.
Throughput?
Throughput, yes. The amount of patients that come into hospital and then how many leave again. Because this is how we're going to assess hospital performance. Because, you know, it's very good for a hospital to have a lot of patients coming in, and it's even better for them to have a lot of them going out again as quickly as possible. Because a patient, by definition, when it comes into a hospital is ill, and when it goes out again, is better. So the quicker they go out, the better they are.
Sorry. So, if I follow your logic, the best possible hospital is one where the patient arrives in an ambulance, smashes up to the main doors, put straight on a gurney, rattles down the corridors, into surgery, where a doctor looks at them and says, yes, that's them. Somebody writes down their name and address, they're back on the gurney, straight to the back door, straight into an ambulance, and home again.
Sorry, do you mind if I write that down? That really is a fantastic idea. We could charge £10 a month and call it fast-track treatment. That would look very good on the brochures, wouldn't it?
Doesn't that jeopardise patient care?
Yes, it would jeopardise patient care. It would make them perhaps go out of the window, which is also a very good idea, because that would cure the bottleneck at the doors. Yes, but of course, I mean, there is a much bigger criteria for this. There are many other things. It's not just facts and figures. There are loads of things to think about when it comes to healthcare. Cost is another.
Money.
Money, yes. Money. We need to save money. And that money we are going to save through greater efficiency.
What does that mean?
Well, it means what it's always meant, doesn't it? Cutting services and replacing expensive qualified staff with cheap unqualified staff and firing anyone who questions our God-given right to do it.
Right. And what result does that have?
Well, I think the main result is many more jobs, I think.
Well, hang on, sorry. You fire a lot of expensive qualified staff and create more jobs for doctors and nurses?
No, not doctors and nurses. More management consultants, such as myself, who are vital.
I see.
Because, I mean, in the long run, that's what's going to save the taxpayer money, isn't it? I mean, it takes 5 to 7 years to train a doctor, and you can become a management consultant in 1 week at Chiltern Glen Hotel.
George Parr, thank you very much.
Pleasure.
What are we changing? Why does there need to be internal marketisation? Why do you need to take it from being one NHS into lots of different trusts that all then have to compete with each other? None of this makes sense unless there are people who have a vested interest in getting something from it. Oh, right. This is about massive corporations seeing that the one thing that you can always monetise is despair. Because there is no market better. If you want a pasty and I'm charging 300 quid for a pasty, you go, oh, I don't really need a pasty. If you need chemotherapy and I say to you it's going to cost £30,000 of chemotherapy, you don't go, well, I don't really fancy chemotherapy now. You go, right, I'll sell my house, I'll remortgage, I'll sell everything I own. And even if not for yourself, you'll certainly do it for your kids, you'll certainly do it for your family. There are people in all of our lives for whom we would do anything it takes.